is Sinkat, physical therapist at Chiropractic and Wellness, and today we have a special guest. This is again Sinkat at Chiropractic. We are located at 4541 North Josey Lane, Suite 130, Carrollton, Texas. This topic is PT and chiropractor, because many of my patients have a question like, how the chiropractor help versus physical therapy. And many people have a misconception like, that either or. No, it doesn't go either or, it can go hand in hand. Every specialty has their own place. They work in different ways. So that's the reason we got this specialist here today. This is Dr. Emilee Quiroz, and she's been practicing in the Carrollton location for almost 5 years. And you can Google and you can see it. She has a wonderful 4.9 reviews on Google, and many of patients that we share, sometimes if it's appropriate, she has referred many patients for physical therapy. I have sent some patients for chiropractor. She do have an X-ray on board. She does hands-on. She does have excellent stuff that can help you to guide you. So we're gonna be kind of talking today that how the PT and OT has their own place. So I'm gonna introduce you Dr. Emilee Quiroz. I'm gonna hand it to her. You can introduce yourself as well.
Great. I'm Dr. Emilee Quiroz, like you mentioned earlier. I have an office here in Carrollton, 3630 North Josey Lane, Suite 110. It's right across from Big Lots. We've been there for 5 years. That is our Carrollton location. We actually have another location in Richardson, which my husband is the chiropractor there. So if you're at around either of those locations, those are both of our locations. He's been over at Richardson for about 3 years, and I've been in the Carrollton area for, like he said, around 5 years now. I'm just going to tell you a little bit about what I do, and then we can discuss what we need to.
Yeah.
All right, so what I do is I specialize in the spine. The spine is made up of 24 movable vertebrae. Each of those vertebrae move in up to 14 different directions. And what I do is I go in and I make sure that the joint is functioning properly and there's no pressure on the nerves that are coming from below the joints. Make sure it's communicating properly to go to all the cells, all the tissues, all the organs, and the rest of the body. So that's basically what I do. I do a hands-on approach. I don't do any modalities or anything. In my office, that's when I send over to Chiropractor if they need any modalities. Yep. Post-op rehab, that's when I send over to Chiropractic therapy. But yeah, that's pretty much what I do.
Yeah, and she made a really good point, because anytime, I believe the scoliosis is one of the things that you can really help, right?
Yes, absolutely.
Because when you, not many people understand scoliosis, because sometimes you won't realize it that your spine is kind of curved. But when we look at it, when the chiropractor, physical therapy, when we assess it, we can see which side is turning and which side is not. And as she mentioned about the organs, so when your spine is turning or twisting, it can cause the pressure on the organ, and it can cause an imbalance between the muscles. So what they are specialized, they kind of adjust it, they make sure it's properly aligned, and then it's your job. And then the physical therapy maybe come in a hand where we can work on the muscles to bring the alignment, because with the scoliosis, one side is pulling and the other side is elongated. So it's one side is stretched, the other side is contracted. So when we align the spine, they bring all the alignment, they do everything, and then if you don't do anything, because see, many times people think don't you feel sometimes when you do adjustment and then they think this is, I'm done,
right,
I'm good, I'm cured.
Right.
But then you have to do your part as well, because if you don't do your part, then it can come back again.
Right.
So it's very important that you follow up, and same with the chiropractor, that follow-up visits also is as well important. What about the sciatic, the cervical spondylitis? Do you help in that one, to decompress the spine, I would
Yes,
say?
absolutely. So I use a very gentle technique where I put my hands on the patient's spine and I decompress it myself, taking the pressure off that nerve, making sure the brain is communicating down to the nerve, and the nerve is able to communicate to that associated organ, tissue, whatever part of the body it's supposed to go to. So I do manually decompress the spine and open up that nerve to make sure it's functioning the best it can.
And the hands-on approach is the best, because there are many tools out there, like the immersion table, many people hanging technique. it can decompress, but when we really when the chiropractor feels the spine, they can see exactly which spine is not moving well. Because see, when you're doing the motion, each and every vertebra should move smoothly. If one is not moving smoothly, then it can affect the other vertebra as well. So when they find out the tightness, they work on it. Now, after that, it comes to physical therapy. If you don't have a strength in your core, or if you don't have an imbalance between the muscles, that can cause more problem. Okay, so that's the reason, that you got the alignment, you feel great. Your the sciatic pain, which is radiating down to your leg, feels better. But then you go home, and if you don't follow up with the back ergonomics, you don't do any exercise, you don't build up your core, again you're gonna get the same problem. And every time it gets worse, because see, many times what I heard here is that when the patient comes, they feel better, or maybe they saw, you must have seen this kind of some patients, they have a back pain, they do some YouTube, Google, they feel better. And then again after 6 months they got it same problem, and they said, I did the same thing last time, but it didn't help this time.
Right.
Because it's progressive, because once the damage happened, it happened. Then you have to maintain it, you need to manage it. And that's where the physical therapy, the chiropractor comes in handy. So you can definitely ask the question, if you have any question, you can ask how, if you have any specific question to your need, we can definitely help with that. Or you can call us, or what's your phone number? You can tell again.
Okay, our phone number is 972-939-2000, and our office is called Quiroz Chiropractic.
All right, so you can call anytime, and you can talk with them, and then they can explain how they can help, or you can call us. If you have any question, we can help you as well. Our phone number is 469-212-8888. So yeah, the main difference is that they're really help with the alignment. They're very specific to the problem. So if you're having an issue with the lumbar, your lower back, your cervical spine, your thoracic spine, they can really help on that one. And as a physical therapist, our approach is more that we see as how's your gait, how's your walking, how's your posture, how's your balance, and we work on those muscles and everything, mobilization and all those things. So it can really help you both if you do it together. You can see faster results. Okay.
Absolutely.
All right. Any specific things you wanted to mention about anything that can really help? Particular diagnosis is what I mean. Sciatic is one of them, but what are the other diagnoses that you see the most?
I see plenty of headaches. I've even seen stuff such as digestion issues, where I can help with that.
Okay.
Because basically, in layman's terms, I'm just making sure the nerve is communicating properly.
Okay.
But we do anything from sciatica, like you've mentioned, low back pain, plantar fasciitis. We even have dealt with that. We open up the nerves in the low back. That way the nerve goes all the way down to the foot. It's able to function properly. But lots of different diagnoses that we deal with. They're really just random, but anything that you have any pain with or isn't functioning at 100%, we can help with. We just have to make sure the nerve is functioning properly.
Yeah, and Allison is saying, you saved me when I was pregnant.
Oh, yes.
And I bet there will be many stories like that, because if you, as I say, just Google it. Because nowadays everything is Google, you can look at it, and 4.9 reviews don't lie. So definitely that helps. But as I say, and I like that point about the headache, because many people don't understand that your headache can come from the cervical spine, because there are different types of headache. But sometimes when you have an imbalance between the muscles in your neck, that can cause you the headache. Sometimes your spine is not aligned, your cervical spine is not aligned, your curvature is not properly maintained. That can lead to the headache. So they can find out, we can really assess and find out exactly where is the issue, and we can work on it. That can really help you with the headache. Because I have some patients, and I bet she must be saying, patient, the headache is really bad. It's throbbing, and it's real bad. So yeah, they can really help you. So any question you have, as I said, you can call us. If you want it to be more personalized, you can call and talk with her, how she can help you, because every person is different, so every approach is different.
Absolutely.
So and I've been to her clinic too, so they have really nice the setup, and they do thorough assessment before they just start doing any maneuvers or any manipulation. So just call them and find out what it is and how they can help you. Okay?
Absolutely. We offer a free consultation to come in and see if your case is a case we can help. So if you want to call and get your free consultation, you can. You'll just fill out the paperwork, come in, you'll discuss that with me, and we'll see if that's a case we can help or not before we move any further.
That's great. You call right now, and as I said, get the consultation. So feel free to ask all the questions, and we offer free consultation, and I like that about it because many times people don't have any clue because why do they trust strangers?
Right.
So that's the reason I think the free consultation is the best way to go because they come in. They talk with you, they explain, there's no obligation, that okay, you got to buy something, but at least they feel comfortable. And once they feel it's the right fit, then you can go from there. Okay?
I think that's it. Thanks for having me on.
Thank you so much, Emilee, for coming. And again, one more time, you can tell the address one more time.
Quiroz Chiropractic, we're located at 3630 North Josey Lane, Suite 110, right across from Big Lots at Josey and Rosemead. And our phone number is 972-939-2000. And our website is www.quirozchiropractic.com.
Any question, just call us, okay? And or you can comment on the Facebook group too. So you just send us a message and we will try to address those for sure. All right then, you all have a good time. Take care.
Bye.